Welcome to a Management Plus training webinar. My name is Kevin Sloan. I'm a certified electronic health record specialist and certified ophthalmic technician. Management Plus is an industry leader in EHR, and we want to provide you with the documentation tools and the skills to use these tools proficiently. Today's training webinar is titled Meaningful Use Report and Meaningful Use Tab Sheet of System Properties. Let's get started. You should have been supplied by your EHR specialist this document titled Client Version MU 2014 from BAT 5714. This document might be a little bit outdated, but is a great reference source when understanding where the meaningful use numbers come from. This document, as I mentioned, might be a little bit outdated, but it's still a great reference source for information. We highly recommend that you look this over in detail in your office when you have time. Please take time to do so frequently so that you are very familiar with where the numbers come from. Paging down, you'll see that there are specific sections with titles. Some of these, again, are outdated, but a lot of these are not. So it will tell you where the numerator comes from and where the denominator comes from for each section. I won't go through each one, but I would recommend that you look through these in detail and become familiar with these. Accessing the Meaningful Use Report is done by choosing File, Electronic Health Records, EHR Report, and then Meaningful Use Report. Let's expand this. I have run this Meaningful Use Report already once, so it has some default information already set up in here. If you have not on your workstation, all of this will be blank. You will want to choose the report of choice. It is your responsibility to research on the CMS website the Meaningful Use program and how to attest and what the measures are, and then to know what stage you are in. I'm going to use this stage right here, Stage 2 2015, for this demonstration. You want to include the templates that you want for this report. For this particular database, there are 3 template arrangements. If you have the optometry forms, you may have 2, or you might even happen to have 3. They'll have different names like exam, optometry, correspondence, and so forth. So you'll want to choose the template that you want to include by flagging that checkbox, leaving the others blank that you want to exclude from the report. By default, the starting date is always 1 year ago from today. So you will want to set this to your starting date. I'm just going to actually choose February 1st, 2016, and I'll just run it up until today. You'll want to choose your physician. Again, I have run this Meaningful Use Report on this particular database previously, so the last physician that I had in there will come back in. This will display all of the physicians within your physician record table, not just your staff physicians in your office. So it will have all of the physicians outside of your office and inside. So be sure you choose the correct physician when doing that. Once you have this set up, it's very easy to run the report. Just click the button that is labeled Calculate. Depending on the date range and how many records that are contained within, this may take anywhere from 2 seconds up to maybe 10, 20 minutes, or maybe even an hour to run. Also depends on your network speed and how much traffic is on the Management Plus database at the time. Let's take a look at each one of these measures. You can see a description here in the left-hand column and a more detailed description in regards to this. The MU 2014 PDF that I showed you earlier will give you information on this. You can also right-click on any of these. The SQL info button will appear. Clicking that will launch a text file that will give you some information about this. Numerator and denominator for each one of these. So this is an SQL code or SQL code, so it might be just a little bit technical, but close analysis of this will give you an idea of where this information comes from. So this is looking for a security risk analysis. So where would you document that? That takes us to the System Properties section of Management Plus. It's found under File, Administration, System Properties, and then you'll click the Meaningful Use tab sheet. There are 7 different date controls here. You will want to document the date that you have completed each of these tasks. The top one here is for your security risk analysis. So whenever you complete that on a yearly basis, you'll want to put that date in there. The second one is when you run a report, basically on all of your patients that have either glaucoma, macular degeneration, diabetic retinopathy, and so forth. You'll want to keep a copy of this report and when you ran it. The third one is for drug formulary checks. That's done through your Dr. First ePrescribe. So once you have Dr. First up and running, you'll put that date in here. The same way with drug-to-drug and drug allergy interaction checks. That's associated with Dr. First. When that is set up on your system and you're able to ePrescribe, put that date in there, so these 2 dates will be the same. The next date here is whenever you begin to run EHR in live patients. Because we have set up your clinical decision support rules for you, they were already within your system. As soon as you start to run EHR on live patients, you can put that date in there because that is built within the system. The next one is whenever you have your patient portal up and running and they are able to send and receive secure electronic messages, you can put that date in there. And the last one is whenever you are actively engaged in public health reporting. This one is blank because for this particular database, they are not engaged in active public health reporting. Okay. Check these regularly. Make sure that the dates are within your reporting period and that these stay up to date. Okay, back to the Meaningful Use report. So you can see that for the very first one, it is marked as true because, as I just showed you on the Meaningful Use tab sheet of System Properties, there was a date there that fell within the reporting period. So it is true. If it does not apply or there is no date, it will simply just say false. Green is always good. Red is kind of either there is nothing or it's below the threshold. The second one is your clinical decision support rules. Again, we have that date marked within our Meaningful Use tab sheet of System Properties. It falls within the reporting period, so it is true. Also, we have set up Dr. First, and we're able to ePrescribe. So our drug-to-drug and drug allergy interaction checks are being done there. So that is true. Objective 3, measure 1. There are actually 3 measures for objective 3. As you can see here, this starts the particular portion of the Meaningful Use report where there are percentages. Every one of these might have a different percentage. This one is 60, 30, 30, and 50, and right on down the line. Some of them only have 10%, as you can see here. So we have 100%. It is asking for more than 60%, which would technically mean 61%. So out of 2 records that qualified, 2 of those were correctly documented. So we have 100%. So doing very good for that. Laboratory orders, There were no lab orders for either record that could have qualified, so it's 0, 0, and 0. And that's perfectly acceptable to have 0, 0, 0 across there. So if you do not do something and it is 0 on all three, not a problem. Okay. The next measure, measure 3 for objective 3, is for radiology orders. Again, 0, 0, and 0. This one in specific is looking for attachment types that are specified as radiology. You know that by right-clicking, choosing SQL, and then looking at this. You can see here that within this database, there are 3 different attachment types that are specified as radiology for the numerator, and here are for the denominator. So if any records had an attachment that was assigned for this type, it would count as that. Attachment types are accessed by clicking on the main screen of Management Plus, File, EHR, EHR Setup, Attachment Types. You're able to set these attachment types up at any given time within your office as long as you have permissions to do so. You can add and subtract and modify these attachment types as needed. You will also need to access each one of these and indicate whether they are an image or a radiology or both. Click this, edit, and you can see that for the A scans, they're flagged both as image and radiology. Contact lens are neither. You'll want to go through each one of these and specify. So for OCT, we can see that images and radiology are also flagged. So when we go back to our meaningful use report, we right-click, look at the SQL, we can see that these 3 types are specified as a radiology. The next one is for e-prescribing. I have not done any e-prescribing on this particular database. Again, you can right-click, look at the SQL code, and look here. If there's a physician indicated on the medication within the medications grid, or otherwise known as the e-prescribed grid, if the flag for prescribed is set to true, and if the formulary is set to true, or transmitted is set to true, and then also formulary checked is set to true, it will count for that measure. So these are the criteria. It's also looking again for an order date between February 1st and April 1st, which is the same date that I have on my report. So you can clearly see where these numbers are coming from. It's not that terribly difficult to understand this. Objective 5 for health information exchange is when you transition a patient to another office, to another specialist, and you are going to transition their care. This also overlaps with direct send, so that whenever you send a patient's medical information via direct send, which could include a PDF of their narrative, could be their test results, and it could include a CCD document as well. Whenever you transition that and you make the correct documentation on the meaningful use form, you will get credit for that, and you can see that we have here. There is another video number 18, which is for meaningful use, and it's 20 minutes long. Details out those controls that you need to document or set flags within. We can right-click, look at the SQL. Again, these are the control IDs here. Transition patient referred, transition summary of care, and transition electronically transmitted for the numerator, and then transition patient referred for the denominator. In other training webinars, we showed you how to determine what those control IDs were. and essentially it encompasses these here for this one particular meaning for use measure. If these are set to true, you will get your credit for that, and it will show up on your report. Again, those are on the meaning for use form in the patient transition to section. It has to be correctly documented in order to get the credit for that. The next one is for patient-specific information. Whenever you provide resources to the patient in regards to their medical problems, and you are providing that to them, generally in a hard copy form, if you feel like a verbal discussion qualifies, that is entirely up to you to make that decision for your office. If you feel like that qualifies as providing patient information. Most of the time it's considered hard copy, but it does not actually specify hard copy. It's just basically indicating patient-specific education resources are provided to patients, only 10%. The checkbox for this is on the meaning for use form. There is multiple methods to get that flagged automatically throughout the record. Medication reconciliation. Again, right-click, look at the SQL code. Okay. Patient referred. It's a checkbox on the meaning for use form. Medication reconciliation value is set to true, also on the meaning for use form. These are set automatically whenever you document that the patient was referred to the office on the physician wrap-up form for the set of ophthalmology forms, and then medication reconciliation flag. It is set via several methods. On the ophthalmology forms, there are several script buttons, and there is also a checkbox on the meaning for use form to set that flag for that. Okay. The next one, we have 0 out of 1, patient electronic access. So more than 50% of all unique patients seen by the eligible provider during the EHR reporting period are provided timely access to view, online, download, and transmit to a third party their health information. So for this particular case, for this database, we have 0 out of 1. It needs to be 50%, so I get nothing for that because I don't have any in the numerator. And so that it's required here that the patient gets access to their health record within 4 days of being seen. Obviously, in this case, although the records were published to the portal, it was not within 4 days of when they were seen. So you'll want to publish those records as soon as your patient's in the exam room, you physically have them in the office, so that you'll get credit for that. Again, it's only really 51%, so just a little better than half of your patients, and you'll be just fine on that. It's a good habit just to do it on all of them, and then you don't ever have to worry about that. The next one here is basically electronic access. So if at least one patient had viewed their electronic health record on the patient portal, this would be set to true. So in this case, they have not, so it is still reading false. So they can either view their narrative or download their narrative, download their CCD or transmit it. Any of those elements will get them that. So if you look at the SQL code, you can see that these are the elements that they need to access on the portal, and then that will set that to true. Secure messaging. This is actually set to true because we have specified in the meaning fuse tab sheet of system properties that we have set the patient portal up and patients now have access, so we have a true there. And then the last one is for public health reporting. We left that blank on the meaningful use tab sheet of system properties, so that is reading false there. I highly recommend that you study the CMS website regularly to clearly understand and to interpret what CMS means here. This comes directly from CMS. This is their actual verbiage, and you will want to clearly understand what they mean in regards to these measures. I also recommend that you run these reports every day for each physician whenever you initially start with EHR. Do that for the first couple weeks. Print each report out every day on the paper and then print those to a PDF as well. So you'll choose print, click printer to go to paper, file, PDF, the floppy drive. You'll choose a location of where you want to put your PDFs of your reports. I would recommend creating a folder, that says meaningful use reports. You can just put those in there so you have a printed copy and a PDF copy of these meaningful use reports that you're running. Once your numbers look good and you begin to run these reports regularly, again, once a day for the first 2 weeks for every physician in your office, and then once you are very satisfied and confident that your report is looking good and it is good consistently, you can back off these reports to once a week. And then possibly after a while, even just every couple of weeks, just to do some comparison from this report to the last, and maybe the report 2 or 3 report periods ago. Compare just to see how your numbers are looking, to see how your trend is. You can also begin to extend out these dates here. At first, you can run it for 1 day, then 1 week, 1 month, and then begin to extend this out. It doesn't hurt to run it for a week, see how your numbers look, then set it up for 3 months or 6 months, and then you'll get an overall assessment of your results. Hopefully, you'll be in the green here on these, or at least expect them to be in the red. If they're in the red, you will be expecting it. So what you're trying to do here is just avoid any surprises so that when you run these reports, you will pretty much know what to expect when it's completed. This concludes our training on the Meaningful Use Report and the Meaningful Use tab sheet of system properties. Thank you.